Hi, I'm Carolyn, the SLP student clinician, and I'll be talking to you today about what happens when you swallow and why it's so important. So, swallowing happens in four quick, easy steps, but there's a lot that goes behind the scenes. So, first, when you eat or drink, your lips and cheeks help keep the food in your mouth while your teeth and jaws chew. Your tongue moves everything around and mixes it with saliva until it's easier to swallow. Next, your tongue gently pushes the food to the back of your mouth, kind of like rolling a ball down a slide. And this tells your throat that it's time to swallow. Then your throat muscles get to work. A small flap called the epiglottis closes off your airway so the food doesn't go down the wrong pipe. At the same time, your voice box lifts up and the muscles in your throat squeeze to push the food down the right tube. Finally, the food enters your esophagus. That is the tube that leads to your stomach. The muscles in that tube gently push the food down until it gets to your belly. So, all of this happens in just a few seconds, but if any part doesn't function properly, the food or drinks can go into your airway. So, this is called aspiration, and this happens often, especially if you don't feel it. And this can lead to cough or even pneumonia. So that's why we're checking your swallow today, just to make sure everything's moving the way it should. Thank you.